En-bloc capsulectomy is a term that you may have come across on social media, particularly if you have breast implants and are considering having them removed. There is a lot of information online suggesting that if you have your breast implants removed, the entire capsule should be removed, and ideally en bloc. Now, is that actually necessary for everybody? The answer is, well, no. In some patients, removing the entire capsule is absolutely appropriate. There are specific circumstances where you may want to remove as much of the capsule as possible and safely. And there are particular conditions where removing the implant and the surrounding capsule intact may be extremely important. But for many patients, aggressive removal, particularly of thin, healthy capsule, can potentially expose them to additional risks without necessarily providing them with the additional benefits. My name is Dhalia Masud and I'm a consultant plastic and reconstructive surgeon. And in this video, I want to explain what a breast implant capsule actually is, what happens to it over time, the different ways we can manage it, and why the correct operation needs to be tailored to the individual patient. So, what actually is a capsule? Whenever we place a foreign material inside the human body, the body recognizes that it's not naturally part of us. The body therefore creates a layer of scar tissue around it, and we call this a capsule. Now, this is not unique to breast implants. Similar foreign body responses occur around many different materials and medical devices placed within the body. This can be hip implants or metalwork if you've had a fracture. There will be an element of a capsule around that foreign body. So simply having a capsule around a breast implant doesn't mean that something has gone wrong. In fact, if you have breast implant, we expect there to be some degree of a capsule around it. For the majority of the patients, that capsule is very thin and soft, and you don't know that it's there, and you can't feel it, and it doesn't cause any problems. So when does a capsule become a problem? Capsules don't all behave in exactly the same way. Sometimes a capsule becomes thicker and firmer. It can gradually tighten around the implant and effectively squeeze it. That is what we call a capsular contracture. It's contracting and squeezing the implant. The capsule tightens, the breast may start to become feeling firmer, the implant can be pushed upwards and change the position. The breast can become rounder or distorted, and eventually you may develop discomfort or pain. At the more severe end, the breast can become very hard and visibly distorted. Occasionally, capsules become extremely thick, and if it's been there for a very long time, it can become calcified, almost like a chalky bone residual. And when I operate on these patients, parts of the capsule almost feel like a solid shell. But there's an important point here. Capsules aren't necessarily uniform. They're not necessarily the same thickness all the way round. You might have a very thin capsule on one area and a moderately thick capsule somewhere else, and a very thick calcified section elsewhere. And that becomes very important when we're deciding what to do surgically. So why are patients having implants removed? Well, there are many reasons. Some women have had their implants for many years and simply don't want them anymore. Their bodies have changed, the breast tissue may have changed, the implants may not have moved or dropped, but they just simply prefer to return to having no breast implants. Some patients develop a capsular contracture, as we've already discussed, and this may be associated with pain and significant distortion. And in other cases, it may have contracted the implant so much that it's ruptured the implant. Other patients describe what we call systemic symptoms that are associated with their breast implants, commonly referred to as breast implant illness. And there are other also uncommon important associated conditions, including breast implant associated ALCL, which is a form of lymphoma. And here, the surgical management is very different and needs to follow an appropriate oncological pathway. So already you can see why saying everybody having implants removed should have exactly the same operation doesn't really make sense. And everybody needing an en bloc capsulectomy also doesn't really make sense. People have very different clinical situations. So what exactly is a capsulectomy? A capsulectomy simply means removing surgically the capsule tissue. And there are different types. A partial capsulectomy is a form. So a partial capsulectomy means removing only part of the capsule, the problematic capsule, and leaving the soft areas behind. And the total capsulectomy means attempting to remove the entire capsule. And this may be in one go, or it may be piecemeal, little by little, where the surgeon will assess what part needs to be removed and what part needs to be staying behind. And then there's the en-bloc capsulectomy, and this is a very specific technique where we remove the implant and capsule together, intact, without deliberately opening the capsule. These terms are sometimes used interchangeably online, but they don't actually mean the same thing, and that distinction is important. So it is really important to go to an experienced plastic and reconstructive surgeon where they can make these very complex decisions by talking to you, assessing you properly to make sure that the appropriate surgery is performed. The aim of the surgery shouldn't simply be to achieve an operation that is a particular name. The aim should be to perform the operation that gives that individual patient the greatest potential benefit while exposing them to the least risk. Why can removing the entire capsule be more difficult? Now, this is a really important question. Imagine an implant sitting in an envelope of scar tissue. To remove the entire envelope intact, I have to separate its outer surface from everything that is attached to. If the implant is sitting above the muscle, that capsule may be surrounded and attached to the surrounding breast tissue. If the implant is sitting underneath the muscle, the deeper part of the capsule can be closely related to the chest wall and the ribs, as well as the muscle. And that's a really important factor that we need to consider. And that posterior capsule that's sitting on top of the ribs can sometimes be thin and tightly stuck to the ribs or the tissue surrounding the rib area. So removing it isn't simply a case of taking out the implant and lifting out a loose bag. We have to dissect the capsule, or we have to peel away the capsule from the tissues that are attached to it. And sometimes there is not a nice, obvious surgical plane. So what are the risks? Firstly, bleeding. Every time we separate two tissues that are very, very tightly close together, we create a raw surface. And the larger the area we dissect or create, the greater the potential surface that can bleed. And that can increase the risk of post-operative bleeding, or what we describe as hematoma, where we have to take you back to theatre to wash it out, particularly if it's a large bleed. Secondly, something called a seroma. A large raw surface can produce fluid while it heals, and that fluid can collect inside the breast and sometimes require drainage. Thirdly, and importantly, we can inadvertently remove and damage normal tissue. Now, if the very thin capsule is intimately attached to the breast tissue, trying to remove every last piece of capsule can sometimes mean taking away some of the healthy breast tissue with it. And that matters because in somebody who already has very relatively little natural breast tissue, removing that breast tissue can give them even smaller breasts than what they had prior to having the implants in. Remember, once the implant has been removed, the breast is already losing some volume provided by the implant. And then if we unnecessarily remove additional healthy tissue, the resulting breast can look more hollow, irregular, and deflated. And correcting that later can sometimes be a little bit difficult. So if you choose to have a capsulectomy of some form, it may be something that you have to accept after the surgery. When an implant has been placed beneath the muscle, the posterior capsule may lie very close to the ribs and the tissues covering the chest. Now, this is very important. Aggressive dissection in this area can potentially damage the tissues around the ribs and the lungs. And a recognised complication is what we call a pneumothorax, where air enters the space around the lungs. And this can be dangerous and in some cases needs urgent emergency treatment. Fortunately, this is uncommon, but it does illustrate an important principle. There needs to be a good reason for taking additional surgical risks. Now, when would I want to remove more capsule? If a capsule is very thick, abnormal, heavily contracted or calcified, this is a good reason for removing it. Interestingly, a very thick capsule can actually be easier to dissect away from the surrounding tissue because you can identify the capsule from the normal tissue more easily. There's more of an obvious layer. Similarly, if there is a suspicion of an abnormal capsule tissue, fluid around an implant, a mass or a concern about implant-associated malignancy, this is a completely different situation. These patients require proper investigation and an appropriate surgical and oncological plan. That should not be confused with a routine implant removal in an otherwise uncomplicated procedure. So what if the capsule is very thin? This is where surgical judgment becomes very important. If I removed an implant and find that part of the capsule is extremely thin, soft, and completely unremarkable, I have to ask myself, what benefit am I giving the patient by aggressively stripping this tissue away? And what additional risks am I creating by doing so? Sometimes removing only abnormal or thickened part of the capsule is the more sensible and correct form of operation. And remaining thin capsule can collapse after the implant is removed and may remodel considerably over time, or essentially soften over time. We can also perform something called a rather than removing the capsule, we make a controlled incision through it. This is very different to the previous surgeries I've described, where we actually remove the capsule. With it, you are making incisions within the capsule to help open up the pocket. This releases the capsule and allows the pocket to open up. If we are replacing the implant, for example, this can help us reshape or enlarge the pocket without creating extensive raw surface associated with removing the whole capsule. Again, it comes down to choosing the operation for the problem rather than choosing the operation because it has become popular online. What about breast implant illness? Now, this is understandably one of the biggest concerns for many patients seeking explant surgery. Some women report a range of symptoms that they associate with their implants and feel significantly better following removal of the implant. These symptoms deserve to be listened to and investigated properly, but it is important to separate two questions. The first is, should the implants be removed? The second is, does every piece of capsule also need to be removed? Those are not necessarily the same questions. Patients sometimes arrive believing that unless their implant and capsule are removed completely intact, their operation has somehow been performed not to the correct standard. That can create enormous anxiety. The surgical plan needs to take into account the symptoms, the implants, the imaging where appropriate, or the scans where appropriate, the condition of the capsule, previous surgery, the position of the implant, and the patient's anatomy. Can you always promise en bloc removal? I think we need to be clear about this before surgery. Even if the intention is to perform a complete capsulectomy safely, safety has to come first. That is key. If part of the thin capsule is extremely adherent or stuck to the chest wall and removing it could cause significant risk of damage to the healthy tissue, the surgeon may decide and make a decision that leaving a small amount of soft capsule behind is safer. That isn't necessarily an incorrect procedure. That is the correct decision to make. It is a surgical judgment. The operation we ultimately perform can only be determined once we actually see the capsule. Scans and examination give us useful information, but they cannot always tell us exactly how thick every part of the capsule is and how attached it is. So what happens to the capsule we remove? When I remove a significant capsule tissue, particularly if there is anything unusual about its appearance, it can be sent to histology for examination. If there is a specific clinical concern, additional testing may also be required. Again, the investigation should be driven by patient's circumstances. What should you discuss with your surgeon? If you're considering implant removal, rather than simply asking, will you do an en bloc capsulectomy, I think there are more useful questions to ask. Why your surgeon thinks a capsule should or shouldn't be removed. Ask whether they are planning a partial or total capsulectomy, and ask what they would do if the posterior capsule is very thin and firmly attached to the chest wall. Ask how removing the additional capsule might affect your remaining breast tissue and your cosmetic result. And ask what happens if the findings during the surgery are different to what was expected. That conversation tells you much more than the name of the operation. My final message is, social media can be incredibly useful for allowing patients to share their experiences and become better informed. But surgery isn't a one-size-fits-all. En-bloc capsulectomy has an important role in breast implant surgery, but it's not automatically the best operation for every patient having their implants removed. Sometimes a total capsulectomy is the most appropriate, sometimes a partial capsulectomy is appropriate, and sometimes releasing the capsule is sufficient. And sometimes leaving a thin, harmless portion of the capsule behind is safer than aggressively trying to remove it from the ribs and the chest wall. The important question isn't, did I have an en-bloc capsulectomy? The important question is, did I have the safest, most appropriate operation for my particular circumstance? This is a discussion you should be having with your plastic surgeon, and make sure your plastic surgeon is experienced in this kind of field. I hope this video has helped explain some of the confusions around implant removal and If you're considering explant surgery, implant exchange, or surgery for capsular contracture, make sure you discuss all of these options with an appropriately qualified plastic surgeon. And if you know somebody who's considering having their breast implants removed, please share this video with them. It may help them understand their options and ask the right questions before making a decision.